Dr. Begay is the Navajo Nation Senior Advisor with the HEAL Initiative under the Division of Hospital Medicine. She leads the HEAL's strategic plan goals of expanding additional sites in addition to Navajo Nation and designs and builds pathways for Native American health workers as they work with underserved communities in both the Navajo Nation and across the United States. She also serves as a beloved mentor to many fellows based in the Navajo Nation, and we're really honored, especially after her harrowing trip to get here today to testify.
Yat Adriann Begay yun siya kapahay na siya ni Basishin katnizat ni dashi chedot ashtia dashanala. I am Edge of the Water Clan, born on the Navajo Reservation and raised by a hardworking single mother. While raising 3 children, completed my undergraduate degree, completed my medical school training, and also completed residency. After completion of my education, I started with the Indian Health Service, and I served initially with the Salt River Pima Maricopa community in Arizona, and then returned to serve my own people at Gallup Indian Medical Center until my federal retirement. Today, I serve as a senior advisor for the University of California San Francisco HEAL Initiative's Fellowship, where I empower Native professionals in healthcare leadership. Throughout my career, I have worked alongside incredible people who go above and beyond to serve their communities. Despite their commitment, we face a health workforce shortage. With more than 80 million Americans living in areas with too few healthcare providers, many of these areas are rural and in tribal communities. These shortages are even more severe, up to 33%, but in some areas of the country, 46% of physician positions in some IHS regions are unfilled. On the Navajo Nation, this staffing crisis combined with long distances, sometimes 100 miles across unpaved roads, can literally mean the difference between life and death. Delayed diagnosis, missed appointments, and shuttering of essential services lead to worse healthcare outcomes. Provider burnout only exacerbates the crisis. We know that where doctors train is a strong predictor of where they will eventually work. As one national study found that residents who spend a majority of their training in rural areas were 5 times more likely to continue practicing in those same areas. However, out of the $25 billion spent on graduate medical education in the US annually, IHS receives no direct funding to train residents or fellows. This means that out of the 145,000 medical residents nationwide, just 77 train full-time at IHS, tribal or urban Indian sites. That's only 0.05%. Despite these challenges, 8 residency and 5 fellowship programs operate at ITU facilities, and they work. In 4 tribal family medicine residencies, 51% of graduates stayed in the ITU system, and in the 3 Oklahoma tribal residency programs, 72% practiced in rural areas after finishing their training. At the UCSF HEAL Initiative, we've seen similar results. Our fellowship pairs U.S.-trained doctors with local site fellows at 19 locations, including Navajo Nation. Of the 37 doctors who served during their fellowship, 11 stayed long-term. That's what's possible when you invest in training rooted in community and culture. These programs can also save money, as it is possible to bring in multiple residents and fellows for the cost of one temporary contract provider like a locum tenens physician. Investing in GME means investing in people who build trust and stay. HR 3670, the IHS Provider Expansion Act, is necessary because it establishes an Office of Graduate Medical Education within IHS, finally giving the agency the authority and the resources to coordinate, fund, and grow these crucial GME opportunities. It's modeled after the Veterans Health Administration's Office of Academic Affiliations, which has successfully partnered with teaching hospitals for over 75 years. Today, the VA's GME budget supports 75,000 trainees and nearly 12,000 residency positions. It's time Indian country also has the opportunity to grow its workforce. As a teenager, I shadowed Dr. Taylor McKenzie, our first Navajo physician. He showed me that someone born on the reservation, just like me, could become a doctor. That experience shaped my lifelong commitment to empowering American Indians, Alaska Native students who want to return home and care for those communities, and this legislation builds on that system. By expanding and coordinating medical education ITU sites, we can improve, expand access, and build a health workforce that reflects and serves our people.